One of the most common skin concerns that I get asked about in my clinic on a daily basis is crepey skin. How to fix it, what causes it, what products are actually worth your time and money. And so today we are talking all about crepey skin. I'm Dr. Sam Ellis. I'm a board-certified medical and cosmetic dermatologist in Northern California, and I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. If you have not heard the term crepey skin before, although I'm guessing you have because you clicked on this video, it essentially is skin that resembles crepe paper, like those little streamers that were hanging from your high school gym's ceiling during prom. Crepey skin tends to be quite thin, wrinkled, dehydrated, dull, and it's something that a lot of people experience as they get older. Common places to see crepey skin are the backs of the hands, the neck, the upper arms, like right above the elbows, the thighs, and specifically right above the knees, as well as the abdomen. Ultimately, crepey skin is a sign of skin aging, and that can be due to intrinsic factors like genetics, hormones, and metabolic state, as well as extrinsic factors like pollution and UV radiation, and we'll get a little bit more into the causes in a second. That classic crepey skin is really due to a loss of the molecules that provide the skin with structure and integrity. These are things like collagen and elastin, as well as hyaluronic acid, which helps keep the skin hydrated. As we age, we are naturally breaking down collagen and elastin faster than we can build it back up, and there are certain external influences that expedite that process. So for example, ultraviolet radiation, sunlight, that is the #1 cause of premature skin aging and certainly can make crepey skin much, much worse or lead you to have it in the first place. Smoking is another way you can damage your collagen and elastin and make your skin crepey. Another common cause of crepey skin is rapid weight changes. So if you have rapid weight loss or weight gain, whether that's muscle mass or during pregnancy, that can lead to that distended skin becoming crepey. And another major cause of crepey skin that I feel like people don't talk about enough is the changes in your hormones around menopause. Specifically, the decline in estrogen in your body can make your skin more crepey. So when we're thinking about people who are dealing with crepey skin, it's often women who are either perimenopausal or postmenopausal. Not only are they dealing with those hormone changes, but they also have accrued sun damage as well as other life changes that have led to crepey skin. Both men and women can experience crepey skin, but I feel like a lot of my patients who are asking about it or bothered by it are women who are around perimenopause or even postmenopausal. And that's because unlike men who've had sort of this slow decline in their collagen and elastin and hyaluronic acid over time with sun damage and just the general aging process, women get this sharp decline of their estrogen in addition to that, which really compounds the issue and makes their crepey skin more obvious to them. And crepey skin is not just an aesthetic problem. Yes, it's thinner skin, it's more wrinkly, it's more dull, but also that skin is more fragile, so it can make you more prone to cuts and scrapes, and really that kind of interferes with the quality of life for a lot of people. So let's talk about what we can actually do to make crepey skin better. #1, and I feel like I have to say this in the beginning of the video, is don't buy Crepe Erase. I feel like they really capitalized on having the name crepe in the title, but that is not a special product in any way. And there are so many better things you can be doing if you're struggling with crepey skin. So let's talk about skincare that's actually worth investing in. First and foremost, if you deal with crepey skin, you need to protect your skin from the sun. Like an ounce of prevention is worth a pound of cure. So whether that's avoiding direct sunlight or wearing sunscreen, those are really good ways to make sure that you are not prematurely breaking down your collagen and elastin, those really important building blocks to keep your skin supple and plump and smooth. Aside from sun protection, hydration and moisturization go a really long way. And I'm saying this because a lot of times people are really invested once they have crepey skin and going out and getting a lot of active ingredients and things like that, which I will talk about. But just basic moisturizer on your skin twice a day will make your skin look and feel so much better. It's going to plump things out, it's going to smooth things, and that is worth so much when it comes to improving the texture and the appearance of crepey skin. One of my favorite moisturizers for crepey skin is from my brand Prequel, and it's the Urea Moisturizing Milk. So this is formulated with 10% urea, and urea is a humectant that draws water to the skin surface, which makes the skin more supple and smooth, but it also has a very light exfoliation effect, and that can make the skin look more luminous and glowy, which is something where if you're struggling with crepey skin, you kind of need. When we were initially formulating this product, I was actually thinking more about my patients who have super dry or flaky or rough skin, but it turns out it's amazing for crepey skin too. I love how much this smooths the skin out, and because it's more of that thinner, milky texture, it's really easy to apply onto a large body surface area, but then not feel sticky afterward. And that's always been like a bigger criticism I've had of products that have urea in them, is like, I like it conceptually, but I actually don't like to use it. And this combines my love of urea with a formula that actually feels good on the skin and is effective. Another body moisturizer that I really love is the Vaseline Advanced Repair Lotion. This is super, super affordable body lotion, but is also very effective if you have dry, crepey skin. This is a little bit thicker than the urea moisturizing milk. So if you're really dealing with like dry skin and you like to feel the product on your skin to feel like you're kind of getting a little hug from your moisturizer, this one's nice. So I just wanted to give a shout out to moisturizers before I moved on to active skincare ingredients, because I feel like moisturization is really underutilized if you have crepey skin. But now let's move on to ingredients and products that are really going to improve the integrity of your skin, help you build new collagen, help you hold on to that collagen, and really make your skin thicker, plumper, and less crepey. So the number one ingredient category is retinoids. I've talked a lot about retinoids on this channel before. They're vitamin A derived molecules that not only stimulate collagen production, but also slow collagen breakdown. To me, they are like an anti-aging holy grail category. And now there are actually a good number of body care products that incorporate a retinoid so that you can use them from head to toe and not just focus them on your face like we used to do. One of the body retinols that I've been using a lot is by Necessaire. It's called their body retinol. Go figure. So this has 0.1% pure retinol, and I actually really like that they talk about how much retinol is in the product so you really understand what you're getting. And in addition to that retinol, that thing that's going to help stimulate collagen and slow collagen breakdown, it also has 10% alpha hydroxy acids, which is another ingredient category that helps with crepey skin. So you're getting kind of like a 2-for-1 in this product. So the alpha hydroxy acids, or AHAs, in this particular product are glycolic acid and mandelic acid. And I sort of think of them as serving two purposes. One is they're going to help exfoliate the skin surface, which is going to make the skin more glowy, but also help that retinol penetrate better. And alpha hydroxy acids on their own are known to stimulate collagen as well. I also really like that this is a serum texture, so it's easy to apply to a large body surface area. And then if you have a body lotion or moisturizer that you like as well, you can go in on top of that serum to get even more nourishment. One thing to keep in mind if you're using products that have retinoids in them or have alpha hydroxy acids is you need to be protecting that skin from the sun because it's going to be more sun sensitive. So just something to keep in mind. Now, with this product having 0.1% retinol and 10% alpha hydroxy acids, it could be a little bit irritating to sensitive skin. So I would start out by just applying it once a day and maybe just a couple days a week, and you can work your way up to daily application, but no more than that. And since I was mentioning alpha hydroxy acids, even on their own, are good for collagen stimulation and reducing crepey skin, I did want to give a couple like exclusive alpha hydroxy acid lotion options. One is the Glytone Exfoliating Body Lotion. I've talked a lot about this on this channel. It is like the strongest glycolic acid body lotion that I have found. So if you have really, really sensitive skin, you might not want to start here. Like when I apply this, it's spicy. We got a little tingle there, but I've had so many patients who I've recommended this to and who have told me like, Dr. Ellis, this really helped my crepey skin. Another body lotion option that I really like that has alpha hydroxy acids and is a lot more gentle than the one from Glytone is the Lactin Daily Lotion. So instead of glycolic acid, this has lactic acid, which is a more gentle alpha hydroxy acid, and it has 12% lactic acid, so a good amount. And again, you would apply this just once a day. And something I'll just say about all the moisturizers that I've talked about is they're not only helping crepey skin, they're also helping treat dry skin, and they're enhancing the integrity of the skin barrier. And really, if you're struggling with crepey skin, you're probably struggling with some of these other things as well. So you're killing lots of birds with one stone. Another product that I really like is the Dermend Fragile Skin Moisturizing Cream. I actually learned about this from a fellow dermatologist, and it has glycolic acid as well as retinol. It also has ceramides and niacinamide to strengthen the skin barrier, and it's very well tolerated. The thing I really like about this is it's quite gentle, so you can use it on your neck. A lot of times people will come to me with complaints of crepey skin and they've been using a lot of stuff on their body, but their neck skin is too sensitive. So if you have a sensitive neck, but you're still trying to expose it to these good collagen producing ingredients, try this. Another product that comes highly recommended by one of my fellow dermatologists is the Revision Skincare Body Firm. So this is definitely a little pricier than the other products I have talked about, but what's interesting about this is they've actually done a clinical study on it where they had people apply it to their body skin, and then they went in and took biopsies, so actual skin samples, and tested it for increased collagen production, and it had it. And I'm not always into like the most expensive skincare products, but I feel like if you are going to be a bit more spendy with your skincare, you want to have some evidence or data that it's actually effective. So that's why I feel confident recommending this. It's also just like a really beautiful texture. It's something I would look forward to applying to my skin. And that's the other thing when it comes to treating crepey skin or really any skin issue, you need to be very consistent to see results. I think skincare is actually a really important part of addressing crepey skin. Of course, nothing is going to take 70-year-old skin and turn it into 12-year-old skin, but every little thing that you can do to stimulate collagen and help keep your skin softer, more supple, thicker, more supported is going to be beneficial. I also think it's worth talking about things that you can do in the office, specific procedures to improve crepey skin or skin texture overall. When we're intervening on someone's crepey skin in my office, the whole goal is to stimulate more collagen production, and you can actually do that in several ways. One way is through what I would call controlled trauma or controlled injury of the skin. Anytime you are injuring the skin in a controlled fashion, the skin responds by healing itself and making new collagen, and that can be really helpful for skin texture. So things like microneedling or radiofrequency microneedling can be helpful for crepey texture, as well as thermage, which just uses radiofrequency. Ultherapy can use ultrasound energy to stimulate collagen, as well as IPL, which is known as intense pulse light. You might have heard it called photofacial or BBL before, as well as fractionated laser like Fraxel. And it's a very normal question to ask, like, well, which of these is the best procedure? And there's really no one best. They have not been compared head to head. So a lot of times it has to do with what's the patient's budget, what's their downtime, what are their goals, etc. Aside from inducing collagen and improving crepey skin through controlled injury of the skin, you can also inject what we call biostimulatory injectables to make your skin grow new collagen that way. Examples of biostimulatory injectables are things like Sculptra and Radiesse. I have a whole video on Sculptra if you want to watch it. And this can be used in various body areas, including the hands, the neck, the décolleté, but you can also use it in the buttocks, above the knees, as well as in the arms. Another thing you can do is combine treatment. So you can use collagen stimulating injectables and then follow that up with a collagen stimulating procedure like ultherapy or microneedling to get even better results. It's also though important to keep in mind that if you have large body surface areas of crepey skin, it can be a bit cost prohibitive to treat all of those areas. So I often have patients zone in on their most desired areas to treat, and we start there. I think it's also worth mentioning plastic surgery. I'm not a plastic surgeon, but if you have large body surface areas with excess crepey skin, for example, on the lower abdomen after having kids or on the upper arms, you can have surgery to essentially completely remove that skin. While we're on the topic of medical and surgical interventions for crepey skin, I do think it's worth mentioning the topic of hormone supplementation. So if you're getting to the point in your life where your hormones are shifting or declining, generally that perimenopausal time, you can notice a lot of different body changes: cognitive decline, change in bone health, and change in skin integrity. And I think hormone replacement therapy or some type of hormone supplementation is coming more into favor. Now, I'm not an OBGYN, I'm not an endocrinologist, so I don't want to go too far beyond my scope, but I think this is worth mentioning. And then the final component when it comes to addressing skin is diet and lifestyle changes. So things like getting enough sleep, limiting stress, and stopping smoking are going to help your overall health, but are also going to help your skin integrity. In addition to that, there's actually a pretty recent study published that showed that exercise, and specifically weightlifting, helps with saggy skin. So all of these things you're doing to maintain a healthy lifestyle are not just about your internal health, but they also help your external health. Regarding nutrition, there's good data to show that diets rich in vegetables, specifically those that are very colorful and have lots of antioxidants, as well as legumes and certain oils, appear to be protective against sun damage. And that repeated sun damage is one of the main causes of crepey skin. So if you can prevent that, you might not be dealing with it down the line. And then I also just wanted to give a quick shout out to oral collagen. That was something as a dermatologist that I used to think was hocus pocus, but there is more and more data to show that oral collagen can help with things like skin wrinkling and skin hydration. I will do a full video that kind of deep dives on oral collagen, but I do think oral collagen has a place in terms of addressing crepey skin. I'm curious, have you tried any products that have actually helped your crepey skin? I want to know about it. Put it in the comments below. Thank you so much for watching. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.